Welcome, and thank you for joining our Health Talk today. I'm Sarah Hagerly with St. Luke's Community Health. I'm a program coordinator. I will introduce our Health Talk today and talk about our disclaimer. The information in our video is not to be construed as medical advice. If you do need medical advice, contact your healthcare provider. All of the contents and information in this video are owned by St. Luke's. There's some housekeeping for today. You are able to ask questions in the Q&A button. What you would do is find the Q&A. Some of you may not have it if you're not logged into Teams. And then you can ask a question or you can type your question. If you have other questions and can't participate, go ahead and email me and we can get those addressed, if not today, at another time. And I'm very pleased to invite our special guest, and her talk today is helping youth improve mental health and prevent suicide. We appreciate the time each of you have taken to join this for this important topic that we feel is extra important in the month of September, Suicide Awareness Month, but also, more importantly, every day. Today, we welcome Dr. Gretchen Gudmundsen, a child clinical psychologist with St. Luke's Children's. Welcome, Gretchen.
All right. Thank you for the invitation to speak today and for the focus on this important topic. The focus of today is really twofold. The first half, I'll really focus on reviewing the current state of youth suicidality, both nationally, but also with attention to Idaho. The other half will focus on sharing strategies and resources to support youth and families and with our communities at large. Before going too far into the talk, I want to highlight a little bit about language I'll be using and terminology, as I think it's important and can be something to think about even as a first step towards doing what we can to prevent suicide and to become more aware of it. So first off, I'll be talking about different types of suicidal thoughts and behaviors. When I say suicidality, that's just really encompasses all of the terms below. So that might be anything from suicidal thoughts or suicidal ideation, which really are thoughts about wanting to end one's life. And also there's something called self-harm ideation, which sometimes overlaps with suicidal ideation and sometimes it's distinct. And I call this out just because sometimes I have been in situations where I'm talking to someone either professionally or personally, and these get conflated. And so wanting to just start to model and highlight how important it is to be clear, to speak, to clarify questions when you're hearing someone talk about this or trying to understand what's going on with someone, because these can be really separate or overlapping urges in terms of the function of thoughts and behavior. So the third concept is non-suicidal self-injury or self-harm behavior. And then finally, a suicidal act or suicide attempt is when someone not only thinks about suicide, but then does something with intent to die. So the other comment I want to make are just some thoughts, planting some seeds about language, because I think there's some ways we talk about suicide that might inadvertently cast a judgment or connote something when in certain circles. So sometimes I think we've probably all noticed that a lot of people pair the word commit and suicide. I think it's just become a pattern in our language. Something to think about is that might connote that it's a criminal act. We really want to strip any exploration or discussion of suicide, strip the judgment away, and really just be trying to be comfortable exploring it, being curious about it, and not necessarily trying to reprimand someone out of feeling that way or having those thoughts. One other comment is that, again, I think without any malintention, some people might talk about a suicide attempt as having been a success or a failure, and just wanting to share the idea that isn't necessarily, we don't want to promote it in any sort of way or judge it. So just some things to think about, and again, which I'll be trying to model. So I might talk about dying by suicide rather than using some of that other language. So shifting to some kind of context here, with the focus being on youth suicidality, I'll speak about national data, but also reference Idaho as well, just to keep us grounded. So suicidal ideation is quite rare before the age of 10. We do really think of it as something that goes with adolescence. So there is a pretty rapid increase in prevalence when youth hit age 12. So that age 12 to 17, we see a big increase in terms of having thoughts of suicide. And overall, that's much more common than actually making a suicide attempt or dying by suicide. So that's an important group to think about. In terms of adolescents, if they do experience suicidal thoughts, about 1/3 go on to attempt suicide. So it is kind of a warning sign or a risk factor, sort of an initial phase to be aware of. Suicide attempt is also rare before the age of 12. So both thoughts and actions are rare, with that similar increase of prevalence when we hit middle to late adolescence, and then it tends to stabilize in the early 20s. Suicide is the second leading cause of death for youth, so including age 12 to 18, and actually it's the second leading cause of death for any individual between the ages of 10 and 44. So that's part of why we really are wanting to focus on this age group. It's actually the leading cause of death for 14 and 15-year-olds. So again, if you're here, my suspicion is that you are aware of and concerned about this risk, but it certainly is important with this age group. In Idaho, we have some specific data from high schoolers. So the Idaho Youth Risk Behavior Survey is typically given every couple of years, and it's delivered in every state to Idaho, or to high schoolers, including Idaho high schoolers, although it won't be administered this fall. So Idaho has withdrawn from the Youth Risk Behavior Survey, so we'll have potentially not be able to continue to follow these rates longitudinally unless we reconsider involving our youth in that survey. But the data really echo the data of people of all ages. So Idaho has a somewhat high suicide rate. So we're the 5th highest suicide rate in the nation, both for youth and also with individuals of any age. The table below shows some specific questions that can be associated with suicidal thoughts, and are very specific to Idaho high schoolers. So when this was administered a couple years ago, about 45% of Idaho high schoolers felt sad or hopeless for 2 or more weeks in a row, and or stopped their usual activities. These are some of the key criteria for major depressive disorder, which is why it's worded that way, but that's a high rate. About 21.3% of Idaho high schoolers seriously considered attempting suicide within the prior year at the time of the survey, and just short of 11% did make a suicide attempt at least once, possibly more times. So that gives a little bit of a picture of Idaho youth. I often find in my role as a psychologist, but also as just a member of our community, people might ask, there's sort of this feeling of, are things getting worse in terms of youth suicide, or is it just in the media more? A lot of people have curiosity about how things are going. And it is the case that things do seem to be getting worse. So this first bullet point shows that survey I mentioned, results from 2011 and from 2021, and we see that there is a significant increase in terms of youth who seriously consider attempting suicide during the prior year. So it went up from about 15% in 2011 to 21% in 2021. So then the next, kind of shifting more into national data rather than Idaho specifically, nationally, rates for suicidal ideation and suicide plans, so again, these are thoughts and precursors to suicide, overall have been trending downward. However, suicide rate, so that is reflective of adolescents who die by suicide, that's increasing. And that's these data, this study shows since 2000, so that's the last 23 years, it's increased by 62%. As I move on, we can talk about, we don't have exact causal factors, but there are some different hypotheses about what has driven this rate up. Things like kind of the role of social media and the kind of increased opportunities, so to speak, of kind of bullying or interactions that can go awry. Economic stress, substance use, COVID. We have a lot of hypotheses that we're still trying to understand as we figure out how to reduce this rate. One other striking finding nationally is that really hit home with a lot of pediatricians and therapists and teachers, people who work with youth quite a bit. In 2016, suicide became the second leading cause of death among teens, surpassing homicide deaths, which dropped to third. So motor vehicle accidents remain the top cause of death. But it was sort of concerning at that point that is, that rate or that imminence is really increasing. Part of this is it's something to think about. Firearms were the leading cause of death for kids 1 and older for the first time in 2020. So that encompasses both suicide and homicide. And that's the most recent year for which CDC data are available. This is a visual depicting this kind of shift that happened. As you can see, it's just in that recent years where we had a shift in terms of the cause of youth death. And again, we're in Idaho, and this is true for the Mountain West too. I think part of this is just to educate our public about how risky it is for youth to have access to firearms. It's a known risk factor, and it can be a difficult subject to talk about, and it's really important to talk about, and particularly with an emphasis on how to have firearms in your home or in your family, and how to be safe. So firearms in youth suicide usually belong to a parent, and reducing access to lethal means saves lives. So that can be done through locks or separating ammunition. That's why it's really always a part of safety planning. This is true for firearms, but of course other means of potential harm, whether that's medications or other toxins, things like that. So, talked about really big rates in terms of youth suicide. I want to briefly talk about some subgroups who are at risk, and then we'll shift more into how we might think about the kids in our life and how we might intervene and support them, knowing that these statistics don't necessarily tell us what to do. But generally, again, these are national data, and race and ethnicity, there's some variability of subgroups, and there's actually been change in the last couple of decades in terms of rates of suicide in different ethnic groups. So the highest rates for youth suicide are in non-Hispanic, American Indian, and Alaskan Native youth. And we see the most pronounced increase in suicide rates in Black youth compared to other racial and ethnic groups. Another group of kids that that are at increased risk are kids who identify as lesbian, gay, or bisexual, or are identified as gender diverse in some ways. And they have higher rates of suicidal thoughts and suicidal behavior compared to peers who do not identify in these categories. So LGBTQ youth are 4 times more likely to seriously consider suicide, to make a plan for suicide, and to attempt than their peers. And over 40% of gender diverse youth in a non-affirming family report a history of suicide attempt. So those are some really striking data. And I think one of kind of a preview, a side message, is that youth who feel accepted and loved and supported and are given space to in their family or in their school or with their peers, that can be really protective for these at-risk youth. Finally, rural urban residents has an association with suicidality, due in part to it being associated with being medically underserved. So we see higher suicide rates in rural as compared to urban communities, regardless of the method used. And these disparities appear to be increasing over time. So thinking again, shifting from some of those kind of background demographics, patterns, statistics, thinking more about coming to individuals themselves who struggle with suicidal thoughts or suicidal actions. When we think about youth and look at that data more qualitatively, some common precipitants are conflict. So that might be with parents or other adults in their life, or also with peers. Certainly interpersonal loss or disappointment is a common precipitant. And I think this is where it's really important to remember that in adolescence, sometimes you might be experiencing loss for the first time, whether that's the loss of, say, a grandparent, a pet, maybe your first romantic breakup. And sometimes as an adults, it can be hard to remember what experiencing those things for the first time, what that can be like. And you have that added layer of neurological development or lack of development of adolescent brains, where sometimes the emotional tenor or tone of what's going on really overrides that maybe logic mind or the long-term view of things. And so it's important to remember that that even though you can maybe see that this isn't a really big deal, it might very well be a big deal to the adolescent or to the teen. School difficulties are also a common precipitant, whether that's academic or more behavioral. Similarly, legal or disciplinary issues are a common precipitant to suicidal thoughts. Abuse, assault, witnessing domestic violence. These precipitants are certainly something that can happen immediately following these types of events or these situations. And sometimes there's a lagging sort of effect of things like even early childhood abuse or adversity, whether that's because of a post-traumatic type reaction and memories, or again, you can think about entering new relationships. In adolescence, there's a shift from your parents being your primary confidant or maybe who you lean on to really shifting to peers. And that's a really developmentally appropriate shift. And then again, can sometimes bring up some past things or some new things that affect the mental health of our youth. Being bullied, of course, is a potential precipitant. And that's what's tricky is that can happen in person, it can happen online, it can be text, there can be texting. So it's really a more challenging thing to have a handle on as a parent or adult who might be concerned about youth. When we look at particular risk factors for suicide, any event that includes humiliation or shame is particularly salient when it comes to thoughts about suicide, in part because, and as we'll get to, that can sort of sort of sometimes people can get really tunnel visioned and not figure out that there might be a way out of this, or that time might really help with a particular incident. Finally, as already mentioned, as kids are sort of maybe encountering some questions about their own sexual orientation or gender identity, that too can potentially trigger suicidal thoughts, especially if they feel that this might irrevocably change their standing in their church or their family or in another setting. So those are sort of from situational precipitates to drivers of suicidality. Again, a question that I encounter a lot is sort of, particularly if people haven't had their own experiences with thoughts of suicide, or sometimes wanting to give up. It can be really a hard thing to wrap your head around, to understand how someone might get there. Especially, I think we sometimes idealize youth and the how fun and free it can be, and it can be hard to appreciate the challenges associated with adolescence. But typically, when we kind of talk to individuals who struggle with suicidal and look at both that from a data perspective, but also a clinical perspective, there often might be an inability to solve a problem. So again, I think in terms of, you have heightened stress, heightened despair, loneliness, isolation. You may feel you're not able to talk about what you're worried about or what's going on with you or your relationships. And this can sometimes, get this, I just keep thinking of this tunnel vision, where you are trying to think about different options, different ways to solve the problem you're in, and not coming up with them. So sometimes, and again, it can be counterintuitive from the outside, but a driver of suicidality may feel like, oh, this is my only way to get out of this problem is to end my life. And even sometimes holding on to this idea that people would be better off without them. And again, so this can be helpful to understand, to potentially be in a position to assure those kids that you're around that they are, we always have a solution. There's always something we can do. And if you and I can't figure it out, we'll find someone who can help us. So a second driver of suicidality is intense emotion dysregulation. So often when I think about this, think about, and this is a concept discussed in the field of literature, you think about people with intense emotions, which can be a huge gift and a liability. So people who struggle with severe emotion dysregulation, that might be a wonderful thing when the emotion is joy or excitement, but when it's depression or anger or anxiety, it can feel really overwhelming to figure out how to cope. And again, it can feel really tricky to understand that this emotion is going to quiet and fade, and then I'll have a new one. But people often will highlight that having intense emotions, particularly negative emotions, might precipitate thoughts of suicide, feeling like that they can't regulate themselves, or they're maybe just kind of tired of or fatigued from having such intense emotions. The third driver is lack of reasons for living. So that might be, common reasons for living that can be a real protective thing to explore with kids. Might be their dog. It might be their favorite musician is coming out with a new album or a new single in the near months, and they really want to see that. It might be their own future. They want to grow up, they want to travel. Very often it's family, friends, brothers, sisters. But if someone feels really isolated, alone, or again has some sort of cloud of shame around them for some reason, they might feel that they really don't have reasons for living. Related, but again, these can often be separate and aren't just the flip sides of each other necessarily. But the final driver that I wanted to highlight today in terms of suicidality is the presence of reasons for dying. So that might be feeling like they're a burden. Often there's an element of truly believing in that moment that others would be better off for whatever reason, whatever's going on. So again, there's just sometimes, or just wanting to end the pain. So again, it's one of those things where it sort of can be hard to fathom, hard to understand how kind of they get to this as being almost a logical conclusion to solving that problem of really intense emotional pain. So those are, again, not a comprehensive list, but pretty common drivers of suicidality. I want to talk a little bit about warning signs, with the recognition that there often are warning signs, not 100% of the time. But again, thinking about who I'm speaking with now, when you think about youth in your life, or really anyone in your life, if these types of things come up, that would be a sign that maybe someone is at risk of, or possibly already thinking about suicide. So it can come up with things they say. So again, feeling like a burden, having no reason to live. And sometimes these can come out seriously, or maybe in the form of kind of a joke or humor. But I would encourage you to take any types of signs like this seriously, and to ask if you're at all concerned, or if it all runs through your head as a possibility. Feeling trapped, experiencing unrelenting pain, not wanting to wake up. So that might be a little bit more passive thoughts of suicidal thoughts rather than an active plan, but it's important to intervene as early as possible. Again, if there's any concerns, sometimes it really can be very clear verbal expression of wanting to kill themselves, or perhaps writing a letter, or voicing something via text or social media. Related to this, I commonly encounter adolescents who are the confidant, or the support or sounding board for their friends. So I think that's another thing, and sometimes an entree. Kids often are talking to their friends, boyfriends, girlfriends, about these types of thoughts, often swearing them to secrecy. So again, for those of you who have youth you love, that is something to ask about them. Even if you're not worried about the kid themselves, just ask if they ever worry about their friends, or if that comes up. It's just something to be aware of. Again, as someone who talks to a lot of high-risk adolescents, that comes up a lot. Behaviors that can indicate a warning sign include that a loss of interest in friends or family, that is, anhedonia, or it's a symptom of depression, but it's, especially if it's even something, sometimes interests change, but if, they used to love soccer and now they just have trouble motivating to even do that, is really striking. Or they just don't really want to go outside and see their friends or do their typical things. They're kind of dragging their feet for the family dinner that they used to like. And again, I think sometimes we're sort of torn between, oh, that's just being a teen, or blaming it on hormones or what have you. But again, I think investing some attention and curiosity to it can help. And if they say, they might be able to convince you that they're not sad or needing any help, but it is worth an ask. Giving away prized possessions is a common warning sign of suicidal thoughts and plans. Engaging in higher risk behavior. So that can be a sort of a form of passive suicidal ideation. So again, maybe the seatbelt's not working, who cares? Or what's that pill? Fine, I'll take it. Just sort of this lack of self-preservation, or just sort of less likely to put on the brakes for something that could be harmful. So that can also relate to substance use. So starting or noting an increase in drug or alcohol use, big changes in sleeping, eating, hygiene, and again, behaviors that you might, like an increase in self-harm behavior, again, can often be a precursor to suicidal thoughts. And or the other thing that's tricky about self-harm behavior, some kids might assert, no, it serves a different purpose. It just helps me to cope. I don't want to die. But you also have to be thoughtful that's dangerous territory. So that you can accidentally hurt yourself more than you intended. So all things to be paying attention to. Other warning signs are changes in mood. So that can be related to depression, anxiety, irritability, rage, humiliation, guilt, but all things that warrant some discussion. So this is where I want to kind of shift our kind of from painting the picture of risk to then what to do. You're here and have teens you love. What can we do to reduce harm and increase safety? And really, step one is showing up to things like this. And we can intercept risk by identifying it and acting on it. One, if you were to walk away with one message today, it really would be asking about suicide is protective. I think a lot of individuals understandably worry that if they ask about suicide, that they might cause it or plant a seed that wasn't there. Because of this kind of question or concern, it's been pretty well studied. They have done at Columbia University in New York, did some of the initial research studies evaluating this. And again, time and time again, in the different ways we've looked at this, we see that asking about suicide is helpful, it's protective. And so I want people to not feel that they might make things worse if they were to ask youth about if they're thinking about suicide, things like that, and or asking their parents, figuring out how to wrap around someone in a way that feels right and appropriate. And that's, again, where part of why we're doing this today is to really make sure people feel that clear on what they can do. And that, with all the data that I presented at the beginning, this problem is big and it's growing, and we are struggling to stay ahead of it. So we really need for people to feel empowered to try and make those connections, to engage the youth around them, and not necessarily to kind of have it siloed to professionals, so to speak. Certainly there are a lot of kids who need specific professional mental health support, and in the interim, day to day, or even between therapy sessions, it's really important that all of us step up and wrap around these kids. So that might be as a parent, aunt and uncle, grandparent, neighbor, educator, of course, our community leaders, and you. I think people might underestimate sometimes the power of connecting, or underestimate the power of being curious about what's going on with the youth around you. And we really, really need the whole village, the whole community to be connecting and with our youth. So moving into, if you see some warning signs, these are just sort of another way to think about it. So I've already talked about these earlier, but they might be direct verbal. Certainly if there's indirect signs, feeling like a burden, not wanting to sleep, you want to be curious about that. Any past behaviors, and then these certain situations. So this echoes the slide that I went into a lot of detail about, so I won't belabor it too much, but these are all things to be thinking about. And again, to be kind of collecting them and holding them in juxtaposition to some of their protective factors, and holding them all together. So if you do see some of these warning signs, here are some tips about what to do that I am kind of borrowed from QPR, which is question, persuade, refer. QPR, it's not an accident that it sounds like CPR. So it's a 1-hour training that I'll share some resources for, that allow, again, all of us to be gatekeepers, or all of us to feel more comfortable just intercepting that risk. So again, I want people to feel open and ready to ask kids that they care about how they're doing. Are they thinking about suicide? Do you have someone you can talk to? Do you need help? And it might be that you're just sort of around and present and paying attention. But if you do see clear warning signs, I would encourage you to ask directly or engage the adults around them who could help you to do that if that doesn't feel like something that you're comfortable doing. If it's an imminent risk, don't hesitate to call 911 or escort someone to an emergency room. And this is if someone, has a plan, is just feeling like they cannot keep themselves safe, even with the protection of their parents or other people that love them. Persuading someone is the P of QPR. So you want to persuade someone to get the right level of help that they need. Not everyone who has suicidal thoughts necessarily needs to go to the emergency room or to the hospital. And that's where connecting them with a professional person who can assess that risk and get them to the right place is really important, since we have limited resource, of course. But you want to err on the side of responding to warning signs and risks rather than under responding. But in general, just listen, try and figure out what they might need help with. Don't hesitate to ask directly about suicide if that is coming up. 988 is this amazing resource that isn't new, but the number's new. So the Idaho Crisis and Suicide Hotline is something to use if you're having suicidal thoughts or if you're feeling lonely or need someone to talk to. If you have someone, you might ask, share this number with a teen, call with them. If you know that maybe they're okay now, but that they sometimes struggle with suicidal thoughts, especially say late at night or when they're alone, this might be something that you make sure they have in their cell phone. You just want to reduce potential harm and pave the way for resources. If you do have the occasion to connect with a teen or individual that you're worried about, you try, maybe see if they'd be okay. Like, hey, do you mind if I text you tomorrow to see if you're okay? Could I follow up with you? I think, again, sometimes we can get a little bit of a deer in headlights or a little bit paralyzed with a high stress, high emotion topic and then not say anything. Again, I would encourage you to stick with people, say something if you're concerned. Some other strategies to think about that echo things I've already said, but talk with youth. If you're concerned about a youth that you live with or that you maybe spends the night with you from time to time, if you're at all worried about suicide risk, it's really powerful to reduce access to means of harm. So that you want to think about things like firearms, of course, but also pills, especially like Costco-sized bottles of Tylenol or Advil, knives, things like that. You just want to make it, I think sometimes people say, well, I can't completely control my teen. If they really wanted to do something, they could. That's true, but time and space is helpful. So any opportunities to make sure that if they get through a really low moment, that it'll be hard for them to act on it is really protective. One thing related to that too, sometimes it's important, again, whether you have two households, moms and dads, or state grandparents, or they're spending the night at a friend's, you want to be sure that all their spaces are safe. And again, just to mitigate risk. Make sure that the person knows that you care about them, that you love them, and very specifically let them know how much you love them and you think that they're an old soul, or you love that they love Pokemon so much, or whatever it is, that you know them and care about them. And in the moment, if again you're finding it hard to talk about, maybe sitting with the youth or watching a YouTube video that they're interested in, or going on a walk, resetting, getting outside, having them sleep on the floor in your room if you're really worried. But that close space and distraction can be really helpful. Longer term, just making sure they're getting connected in healthy, safe social activities. If they need professional help, supporting them to get connected with those resources, talked about 988. And certainly for more imminent risk and inpatient hospitalization can really be protective. And you can always call 911 or take someone to an emergency room for an evaluation if you're just not sure what to do. So here's a call to action. You're already here, so check mark. I really appreciate, again, this audience's interest in this. If you want to do more, so here are a few options, a few ideas. One is to integrate destigmatizing language in your dialogue with others. Again, thinking about just making it clear that you're an open, non-judgmental person, and being present, being a loving, consistent, supportive adult to the youth in your life. And maybe if you have a loved one that lives elsewhere, just making sure you randomly text that person or, call them. The youth don't answer the phone so much, but maybe a text, or sending them something that reminds you of them. Don't hesitate to make those little bids, those little connections can be truly life-saving in the immediate or long term. Be there for yourself. It's always important to take care of yourself, whether exploring some of this or I know people have had their own experiences with suicide, whether it's their own thoughts or behaviors or people they've potentially lost. It's important to just make sure that you keep again, some self-care on board. And then it can be really a win-win to take care of someone who might be struggling in whatever ways possible. I mentioned QPR, that question, persuade, refer. So you might, if you are hungry to learn more, take the free self-paced 1-hour virtual QPR training. I think we'll be able to provide some links for that, but the Speedy Foundation and St. Luke's are very generous. NAMI, a lot of, there's just sort of shared recognition about how important it is. This training is really helpful. So we try to make it easy to get that training. If you want even more, there's something called assist training, and that is a 2-day training that, again, is often provided throughout the state. If you want more in-depth practice about how to assess risk and foster safety in a maybe more intensive way. There's a number of coalitions and groups in Idaho that are focused on suicide prevention. So there's an Idaho chapter of the American Foundation for Suicide Prevention. I mentioned 988. NAMI Idaho has a number of groups and resources and a community, as well as the Speedy Foundation that I mentioned. As we shift to fielding some questions, I also don't want people to feel burdened by the weight of this topic. In the big picture, losing youth or losing individuals to suicide is rare. And of course, one loss to suicide is too many. So we need to kind of try to hold all of those truths together. It's a problem here in Idaho, even more so nationally speaking, both with our teens, but also with individuals of all ages. Suicide is preventable, and part of what we're talking about here today is part of the prevention. It's being aware of it, not being fearful of it, not withdrawing or becoming quiet or retreating, asking about suicide for fear of making things worse or because it is hard. But every little bit all of us can do is really important. So having open and inclusive conversations with family, friends, coworkers, neighbors, And again, that last message that I just will keep highlighting is how important it is to ask directly about suicide. So if you need to practice in the mirror, practice with your partner, or if it really is something you don't feel like you can do, connect that youth with someone who does feel able to do that. Here are some resources that are a mix of sort of some national, sort of the vetted kind of the best resources where we go to for evidence-based suicidal intervention or assessment. So the SPRC, American Foundation for Suicide. We have 988, and then Idaho Lives Project is specific to Idaho and provides a lot of resource and support for youth and young adults. So any individual up to age 24 who has a suicide attempt history, if they don't have insurance, I mean, maybe they're hitting that window, they can get support services. The Trevor Project is specific for LGBTQ youth. Often, sometimes youth are reluctant to talk to people unless they are aware that it'll be an affirming person or someone who might be aware of gender diversity or being queer in some way. And so there's specific supports. We have the National Crisis Text Line for hearing impaired individuals. I included a couple other skills. These two websites are something you can use in the moment if you're with a youth that's struggling or struggling yourself. NowMattersNow.org has a host of resources of ideas what to do now, what not to do to keep yourself safe, and some individuals find that to be really helpful. DBT is an intervention for suicidal individuals, and they have a specific group of skills, distress tolerance, and they're called TIP skills. But this link includes some YouTube videos that, again, are vetted. They are kind of blessed from the DBT creators if you need a refresher about different ways to cope in the moment with acute suicidality or acute self-harm ideation, that kind of thing. But always want to share all of these widely. And with that, we can take questions. Also, I think we'll be able to share the slide deck, but this includes the references from today's talk. But I will pause and have Sarah direct me to some questions that have come up.
Oh, thank you so much, Dr. Gudmundsen. I really appreciated all the resources and information you shared today. Going back to one of your first slides, we had some questions about the survey that's being discontinued. Can you share more about that, or is there other alternatives that we can look to in the future?
I don't have the thinking behind why Idaho withdrew from that survey. I am aware that a lot of individuals involved with promoting suicide prevention with youth have really encouraged this to be reconsidered, because we really, if we can't measure it, we can't track it. You know, it's hard to intervene and improve if we just don't know the lay of the land. But I don't have a lot of detail beyond that. Megan Smith is a professor at Boise State who's doing a lot of work in this space as well, and she, I think, is done a nice job of partnering with local communities to understand, even at a more granular level, what's happening at our specific schools in the Treasure Valley area. I think with goals to expand that to more parts of the state. So we will have that data to evaluate as well. And I'm hopeful that we, and I'm aware that there are people who are trying to enlist or, you know, say, hey, we're concerned that we're not going to be doing the YRBS. Could we revisit that? But I can't speak to more detail right now about who's the decision maker there.
Yes, thank you. That's appreciated. There's several questions that came in things you've already addressed. One question I'm going to re-ask is, what's a good way to engage parents and guardians?
I think my experience is that to hold on to assuming positive intent and to keep in the front of mind, and everyone's doing the best that they can and they need to do better. This essentially just recognizing that if parents are for some reason not either hearing or are potentially exhausted and frustrated by what's going on with their child, I think just meeting them with some grace and openness is really important. I think also just highlighting that kind of that comment about how easy and understandable it is to sort of dismiss or minimize what teens might be identifying as the drivers of either suicidality or what's driving their acting out or being grumpy or not, isolating to the bedroom. But you want parents to just remember that it's really hard to be a teen, and if they can create some open space and a little bit of flexibility and try to meet the teen where they're at, that's really helpful. I think engaging parents with, I think often in a number of topics, parents, especially with mental health, there's a history of parent blaming or that kind of this idea that parents have caused a kid to be suicidal. And we know that suicidality is a very complicated issue. And if anything, we would want parents to know that, like, what do you need? Do you need me to hang out with your kid while you go for a walk? Do you need help identifying resources? Do you want me to call your insurance or what have you? I think just sort of using the same sort of ideas that we talked about with teens with parents too. They are often usually kind of immersed in the same set of stressors or possibly in a place where they're having trouble talking or connecting to their teen, even if they want to. So I think just meeting parents where they're at, assuming positive intent and supporting them in what ways they want, need, and ask to be supported is really important. I, have had occasion to talk to parents who've lost their children to suicide, and I think those parents would really encourage the other parents out there to just do what they can to take a moment and maybe open some of their expectations up or open some of their ideas up, knowing that ultimately that could be really protective. I think parents are always trying to make decisions with the best of intentions and best of goals for their kids, and it's just really complicated to do. Being warm and firm and kind of integrating all that you feel like you're supposed to do is a lot.
That's great. I appreciate that. Definitely. Someone also, I haven't searched this particular resource. Someone mentioned there are up to 24-hour service centers for youth and families, such as the Bridge, and that it should be open now, and Pathways for Youth, which is coming soon. Are you aware of those centers?
The Bridge is, I've kind of vaguely heard about it, but that is excellent. I was actually just talking to someone involved with the Pathways Youth Crisis Center. I think they were supposed to open in June. I think it's now mid-October, but those are coming soon. So at least Pathways I'm more familiar with, and that's a youth crisis center where people can physically go there if they need help or need, again, some space maybe from home. Hayes House is another great resource in our community for those types of crises. Because again, sometimes, for example, an inpatient hospital is an appropriate setting, and sometimes you just need sort of a break and space, and don't necessarily need the the hospital. As a community member, that can be tricky to figure out. So it's important to get the right assessment in place. But those resources would be places where they could help suss out where does my kid need to be now, and how do we help them both now, but also prevent it from coming back or getting worse down the line.
So true. So true. That made me think about an initiative that St. Luke's and the United Way and several other agencies are promoting and supporting in Idaho. And I put the link in the chat, findhelpidaho.org. You can type in your zip code and it will show, and any service that you want. I typed in suicide prevention and my zip code, and it came up with 101 resources. Yeah, that's a really great service that's free, quick online search. It has food, housing, transit, all kinds of things. So there's two things I want to point out. One, it's a great resource. And then two, if you know of any group that's not in that, email Find Help, email me, because we want everyone to be listed in there as a quick and easy, at our fingers, updated resource. People are behind the scenes updating these facilities and services minimally 3 or 4 times a year for each site. And we're just adding more to make it better and better so that Idahoans have access to resources. So that's
wonderful.
Yeah, that's a good one. Then there's a question for you, wondering what are your best practices and programs that rural schools can implement?
In terms of rural schools, I think, again, sometimes arguably the burden's even higher on the community to become more educated, given, telehealth and video mental health services have helped a little bit, but there's often, it can be harder to access specialists. So whether that's a therapist or a child psychiatrist, or even going to a hospital is a bigger burden. You might have to go further away from home. So because of that, that's where I think I would say the call to action is even maybe a little louder in terms of doing things like QPR or educating in assist or mental health first aid, or making sure that in sort of the natural communities that exist in rural areas, whether that's around certain community events or parades or things that are going on, or say like the family doc, or I think it just sort of expands the call to action for anyone interfacing with youth to take maybe even more of a leadership, proactive role in paying attention to warning signs and potentially reaching out to a kid you're worried about or who seems quiet or you're not sure about, even if it might feel a little bit beyond scope. I think it's that I always think of how that data point about how rural areas compared to urban areas and that medically underserved overlap is a real vulnerability, especially for youth who might be prone to feeling isolated, alone, no one cares, or they might not be able to see that in some way that they might be different, whether that's because of neurodiversity or because of the color of their skin or because of they like Dungeons and Dragons or they like whatever, fill in the blank. If you feel you just have fewer people with whom to make a connection. And so a connection with an adult, even if it's, again, if it's your neighbor, if it's someone with whom you don't have a formal connection, we need to kind of leverage those informal connections. I think my suspicion is part of what's happened in the last 20 years is we always talk about our village and just sort of losing, knowing who your neighbors are, seeing different patterns, noticing things that we really need to push against the, again, not saying anything, being quiet, but erring on the side of reaching out, saying something, making connections, even if you're not supposed to, or that's not your role. We need to kind of all take that on, I think.
Thank you so much. I was reminded that you mentioned Dr. Megan Smith and doing research. I added her nonprofit group called Communities for Youth in the chat as well. She is addressing connection as is the key, so feel free to check that out as well. I also wanted to tell everyone who will be watching the recording, I did add resources for 988 that you mentioned earlier. You can call or text 988, and the national research or resource online is 988lifeline.org. And you mentioned QPR a few times, which is really an incredible and short 1-hour training that all of us can take and learn more about how to feel comfortable with those conversations. And that is offered free at thespeedyfoundation.org. If you click on trainings, there is QPR, and it is sponsored by several groups, and we appreciate being able to share that with our community for sure. And any closing thoughts?
I think I'll only echo my take-home messages. Again, I really appreciate both your team for inviting me to talk about this. I really appreciate everyone who attended today, and just really hopeful that we can just keep forming connections to support our youth and sort of shift this in the other direction and really take care of each other. So thank you very much.
Thank you. I'll echo the thanks as well. Certainly your time is important, Dr. Gudmundsen, and I appreciate that. Thank you to everyone who joined. We will have this posted online at a later date. Thank you and goodbye. Have a great day.
Thanks. You too.